about doing this. We're going to provide an overview of dual system youth innovations and programs from a national perspective, but we've got the privilege to bring in some of our Nevada colleagues to help us with really what's happening in their jurisdictions later in the program. This is an offering of the Nevada Center for Juvenile Justice Innovation, which is a statute-created innovation center in Nevada that our National Center for Juvenile Justice helps to staff with content. I'm the director of the National Center for Juvenile Justice, which is the research part of the National Council of Juvenile and Family Court Judges. They have us located in Pittsburgh, Pennsylvania, to provide some distance from the membership organization and some objectivity to our research. I'm joined by Gene Siegel, my colleague for the last 30 years at the council and NCJJ, and the Honorable Bridget Robb from the 2nd JDC Family Division, Lorilee Sutton also from the 2nd JDC, and Cheryl Wright from the Department of Juvenile Justice Services in Clark County. These are all folks we know well and have worked with in the past, so this is a real delight. We've only got an hour, so we'll present a lot of information. The slide deck's meant to be a resource to you. It has a lot of resource links to research, program evaluations, and so forth that I'm going to run through in about the first 20 to 30 minutes. And then we're going to start getting into kind of some of the nuts and bolts of dual status youth coordination in the 2nd and 8th JDCs. So to start out, it'd be good to know where folks are from. Gene's going to be monitoring the chat. So if you are inclined to, please use the chat to let us know what court, what system you're from in Nevada. And while we're okay, the 3rd Judicial District Court. Welcome, Sarah. And while we're waiting for others to add to that, we're going to launch a couple polls just to kind of get the climate for what you all are up against with this topic. So thank you, Fabi, for doing that. We have a poll here on overall, why are dual system youth cases important to coordinate? Why is this topic important? Oh, we got folks from the Washoe Tribe of Nevada and California and from Las Vegas in private practice. Let's see if you can use the poll and we'll get a sense of kind of where you land on this topic. Okay, so one person's weighing in that they're just really all of the above. They're more complicated than other cases, more adverse outcomes, and take more time to manage. And that seems to be where everybody is thus far on that topic. We've got other folks joining from the Department of Social Services, and everybody's saying that all the above really so far. So Fabi, we'll end that poll. Share the results. And so overall, okay. So Fabi, did you launch the second poll?
It looks like all the questions were on that one.
Oh, okay. Okay. So we'll move forward then to the objectives for the day. So our objectives for the day are to learn and understand the different terms used to describe dual system youth and why these terms are important, particularly as they relate to case outcomes for the DSY program target populations. Learn that outcomes, recidivism, and other measures for DSY youth are significantly worse than for youth who do not have dual system involvement. Learn about just kind of generally the research on the relationship between child maltreatment and delinquency, the growing body of dual status youth research. So we're going to give you some shortcuts to really quickly become very well educated, informed on that topic and the latest research, and learn and understand the criteria for what is the status in terms of evidence-based practices and programming for dual status youth. And that they're promising programs, but there hasn't been yet any that have met a high standard yet. So over the years, DSY interventions have increasingly, part of the challenges they are referred and the topics referred to in a whole variety of different ways: dually involved youth, multi-system youth, crossover youth, dual jurisdiction youth, dually adjudicated youth, dual status youth, and I think more recently what has emerged, and we'll support with some of the findings we show later in the slide deck, are generally recognized today as the kind of all-encompassing category, dual system youth. So why is the terminology important? Well, it's important because it helps to emphasize how youth are identified early and the specific interventions to prevent and halt their adverse trajectories. At the beginning of implementing a program, you have to develop your target population for those interventions. So the population and their level of penetration in the child welfare and the juvenile justice system and their trajectories in the system is important. And without clearly identifying them, it becomes difficult to determine eligibility, proper screening, and then also measuring outcomes. Some programs have multiple levels of eligibility, ranging from informal dual system involvement to formal dual system involvement. And others are much more targeted in terms of the intervention and the coordination they're attempting to provide. And they always, regardless, they require high, exceptional levels of collaboration and communication between juvenile justice, child welfare, but yet other partners too, mental health service providers, schools, and others. So how many of you, and you can throw this in the chat, or are familiar with the crossover youth practice model from Georgetown University's Center for Juvenile Justice Reform, and or the Robert F. Kennedy's Dual Status Youth Initiative? Collectively, over 110 jurisdictions have participated in CYPM alone. So if you have experience with either of those two, please throw that into the chat. The link between child maltreatment and delinquency has been repeatedly documented back to the 1980s, with strong relationships between the histories of abuse and neglect and subsequent delinquency. And the next four slides provide a cross-section of studies that our organization have been involved with over the years, and then more recent studies that bring everything kind of up to date. So in the 80s and 90s, there was Kathy Whitem and other colleagues found the relationships, kind of the foundation in research that led to subsequent studies that we were involved in, to look at the long-term impact of adult criminality and violence and the correlations between them. The early research emphasized the importance of child welfare and juvenile justice working together to prevent negative trajectories. The QR code will give you a link to one of the examples that Gene selected that he thought was, but because there's a whole line of research in that area that took transpired during the 90s into the early 2000s. So there's a link as a resource for you to dig into kind of the foundational research around the relationships that necessitate action. And then we conducted a dual jurisdiction youth study in the early 2000s, early to mid 2000s. And my colleague Gene was involved in that. I was working here at the time. And this was one of the first studies to document with administrative data from a court system, the prevalence of juveniles with both with formal involvement, duly adjudicated in both the child welfare and juvenile justice systems. It also documented the adverse trajectories for those youth compared to juveniles without cross-system involvement. And it was a landmark study for in a lot of ways for our organization, and led to some successful reforms. Again, the QR code is provided to get to that study. And then later on, again, with collaborations between our director of research at the time, Greg Kalimba, and Gene Siegel, we studied the prevalence of dual system involvement in the King County, Washington, Seattle, Washington court systems, and looked at it in a lot of dimensions and cross sections. But bottom line, found that as many as up to 70% of the youth families involved in that system had touched the child welfare or the delinquency system prior to child welfare in some sort of way. And that study is very informative and foundational, and is available with the QR link. Next, we have more recently and more comprehensively than the studies that preceded it, a national study, dual systems youth design study that had a goal of trying to develop a national prevalence statistic. This was led by Denise Hurst and Carly Durkheising in 2019 on behalf of the Office of Juvenile Justice and Delinquency Prevention. The study attempted to ascertain the prevalence of dual system youth nationally, and then it contains the prevalence estimates and useful practice and intervention recommendations for DSY programs. And it helped to establish that a national prevalence statistic might be too cost prohibitive or too expensive when they were able to establish a high level of interconnectedness and dual status involvement in New York City, with administrative data from New York City, from Cuyahoga County, Cleveland, Ohio, and from Cook County, Chicago, Illinois. And so they kind of shifted the dialogue from a national prevalence statistic, which could take years to develop. And I think folks on this call probably understand some of the dynamics for that in terms of just being able to do that in one state with administrative data. It turned it into more of a dialogue about the research has really, the prior studies that I shared, other studies that we didn't select, and then this national study, that there's a high level of intersection. The hyperlink goes to a webinar where the findings were presented that is a great investment of your time if you're interested in this topic, because it's really the most authoritative and recent summary of national research on the topic. So there's also been, so it's kind of all those studies really focused on prevalence, trajectories, pathways, how many youth started in a juvenile justice experience and then had a child welfare involvement, or how many had a child welfare involvement initially, and what that type of level of that involvement was, and then subsequent juvenile justice. There's also some studies that have been looking at evaluating the impact of trying to do something about those trajectories. So one of the ones that we selected to share with you is from Omaha, Nebraska, which is Douglas County, Nebraska. And it was a CYPM, Crossover Youth Practice Model Initiative. And it involved very strong child welfare and juvenile justice collaboration, and in rural but also some kind of in urban, but also with some rural areas in the county. And the key findings were it increased the number of youth diverted or dismissed, increased the number of delinquency and dependency case closures post-identification. This is one of the studies that had some of the strongest findings and a high sample too in terms of statistical significance, and reduction in new sustained juvenile justice petitions post-identification, reduced likelihood of receiving any new arrests 9 months after identification, fewer number of arrests and longer time to recidivate after closure, and arrested, so some desistance findings, and they were arrested for less serious and less violent crimes when there wasn't a subsequent arrest. Better living situations, so folks working with this population may be tuned in that stability in terms of placement can be a challenge, and some more were a higher proportion were at home. Fewer group home and congregate care placements, that's a really important impact. Fewer detention or correctional placements, improved pro-social behavior, and significant cost savings compared to this. Had some cost analysis to it in compared to the comparison group. And we provide a link to the study, which was completed in 2017. We also chose to select Minnesota's evaluation of their crossover youth practice model. It evaluated youth recidivism in a Midwestern county with and without CYPM. And four key findings were a reduction in youth's risk to recidivate, more direct and immediate access to service, so more timely services. Once identified, crossover youth were typically diverted or more likely to be diverted from juvenile justice to social services. And the program target population involved dually involved youth, youth with some level of cross-system involvement. And then finally, in terms of a cross-section of research, program evaluation research that can help you with your local projects, California's CYPM evaluation is also notable. It received a promising research evidence rating, and its key findings are in the California Evidence-Based Clearinghouse on Child Welfare. And there were numerous benefits, including positive culture change, which I think is a really important aspect to this topic in terms of why it matters to do something different, and in multiple types of jurisdictions too, which is why we included it, not just urban, but rural as well. So next, we're going to briefly discuss two dual system youth initiatives in Nevada. Project one. So when I say briefly, in terms of me talking through it, our part's going to be pretty short, and then we're going to turn it over to the folks actually doing the work in both of the jurisdictions. So first, we're going to focus on project one in the 2nd Judicial District, and then after that, the 8th JDC's Emerging Dually Involved Youth Commercially Sexually Exploited Youth Initiative. And that's where we'll turn it over to our other presenters. So Gene and I had the opportunity in 2018 to evaluate the impact of Project One in the second JDC. And we had 10 key findings that were statistically significant. Not everything there was quite a few positive findings. Not everything came out as we expected, but I think it helped the court with adjusting, and it is a project that has been sustained too, which in this arena is a real challenge. So projects have come and then they have been difficult to sustain sometimes. So we had fewer judicial officer changes in the pre and the post group for the post, and the youth in the program experienced more jointly attended child welfare and probation hearings. They had on average nearly 5 fewer HSA placements. They had close to 2 fewer on average detention admissions, 1.8 fewer. Had on average about 1 less hearing continuance. Had on average more timely probation case, DJS case closure, Department of Juvenile Services closure. And we're less likely to terminate from DGS with successful but so this is one of kind of our confounding findings. They were less likely to terminate from DGS with successful closures and more likely to be committed to DCFS. But I think those findings kind of help the court navigate and grow from there. And then they had fewer DJS referrals after a Project One assignment than youth in the comparison group, and had fewer new delinquency referrals between the delinquency petition and the court date. So there was less, they were less likely to have a subsequent activity while they were waiting for their original case, their Project One case to resolve on the delinquency allegations. And they were more likely to age out through a good number of cases continuing as transition cases beyond age 18, including those who participated in the HSA's extended care program. So with that, I'm going to turn it over to Judge Robb and Lorilee, who have joined us to talk a little bit about what currently goes on with the Project One docket, and helping us confirm that it's still happening and how many active cases generally the program has and the types of kids they're working with.
Thank you, Hunter. And if you want to direct us toward various parts of this, I'm happy to take the direction. If I recall correctly, this program was stood up in Washoe County in it was late 2015, early 2016. And then Hunter and Jean were doing the studies and gathering data. There have been only 2 judicial officers who have been the as we call them, P1 judges in that time. It was Judge Egan Walker, who is now on the general jurisdiction bench, who stood this program up for the 2nd Judicial District. And when he moved over, I was fortunate enough to be able to move into this position as the presiding juvenile judge. And this program, I think right now, it's been bumpy. We have had circumstances at the beginning where one stakeholder was just about ready to leave the group, and it was a significant stakeholder, which would have caused the entire project to fall to the ground. And then later on, another stakeholder was kind of questioning some efficacy in the way things were done. And we have been able now for the past several years to really get buy-in with our stakeholders. There is, and I think it is enjoyed on both sides a really nice cross-pollination between juvenile services and juvenile parole, and also Washington County Human Services Agency. They are talking to one another quite a bit more than they had before. I mean, they weren't siloed before, but now those lines of communication are very, very open. Project One was one of the first court categories to go back to full in-person court hearings when the court was opened up to in-person hearings once again after the closures with COVID. And that was important. And it was important because although you can make relationships with people on a screen, what you don't have is the time before and after hearings when people are talking about what's going on with the youth who was just part of the hearing, or what's going on with the youth who's going to be the next hearing. You've got all of those stakeholders together and able to share in a way that Zoom really didn't accomplish for us. It's also, I think, very important to have the youth as often as possible in the same room. It's more meaningful. Eye contact and body language are huge things with these kids, and they're really watching for that. And so being in a room where they are getting that kind of feedback from everyone around them, I think is really important. And so we have had some, and this is anecdotal, but we have had some really marvelous successes from this program. I've got a couple of kids on my calendar, one of whom his case is closed, but he had gotten an offer and was going to the University of Nevada. He was going to go to college and was very successful. We've got a couple of kids who are going to Truckee Meadows Community College. So they have found their groove. They've worked their way through. They're getting the supports they need, and they are able to be successful and move on. We've had a couple of other youth who, started out with juvenile services and then moved to DCFS placement. But those placements aren't always a negative thing. Sometimes you just need a stronger placement with more guidelines for these youth to be able to help them be successful. One of the most difficult cases I've had on the caseload the entire time I've had this was a young man who we would have 20 stakeholders on our Zoom calendar because we needed DCFS, we needed the attorneys from the AG's office representing those people. We had people who were here for juvenile services because the youth was being detained at Jan Evans, which is our county facility, when in fact he should have been in a DCFS facility from the beginning, but there wasn't anywhere to place him. And once we would get him placed, he would then elope within a couple of weeks, sometimes a couple of days. And so we had real difficulty with him and getting him stabilized. And the really wonderful thing about Project One was all of those stakeholders sat around, they were creative. We found ways to be able to help this young man. And he is doing, I just had his hearing last week. He is doing so much better and will be back in the community. We are looking at the end of September or early October. And this is someone who it would break my heart because I so wanted him to be successful. But he was having difficulty, and he now it really seems like he has turned a corner and is being successful, but it's because of the efforts of both sides of the house, as I say, from both Human Services Agency and the services they can provide, and Juvenile Services and DCFS as far as what we are doing to try and help this particular person. The some of the struggles that we have as well, I find more in the female population, because a significant portion of these young women have been trafficked. And so we are really trying to help them with their psychological needs with regard to that circumstance. And we have mentors. There is a mentorship program here in the North. They become part of our stakeholder group for those young ladies. And so when I say stakeholder group, sometimes it is a bit amorphous. We bring in the talents that we need for whatever child we have. But I think the reason that the program is continuing and is continuing fairly successfully, even though this is a huge use of resources from everyone involved, including the court. I think these are resources that are well needed and also well used. We've got a young lady right now, she's pregnant, but because of everyone's efforts, she's clean, she's got a job, she's getting her education, she's getting the prenatal care that she needs, and she's currently being supervised by Juvenile Services. But those are outcomes, and having a clean and drug-free baby is that's a win, and is worth all the resources I think that we can throw at this program. Just that one outcome. And so when we see positive outcomes with these kids, I think that helps the stakeholders dig in and really recommit to continuing to do this. We have, I think right now, really good cross utilization of talent, and everyone is there. I think they enjoy this calendar. I know I do. And so I think that's one of the reasons we have been able to maintain the calendar and to keep it going, is simply because the stakeholders are as invested as the court is in seeing this be a success. And that didn't used to be the case. The court was leading and cajoling and kind of moving people along at the beginning. And that kind of effort isn't necessary anymore. We have real buy-in, and I see this program lasting for the indefinite future, because we are having good results, not in every case, but we're having good results that are positive and that keep everyone enthused to continue with the program.
Thanks, Judge. I'm sorry.
I was wondering if I could have Lorilee tell you about our stats. It's a relatively small group, but given the amount of coordination that is necessary, it kind of needs to stay small. Lorilee, would you like to chime in?
Sure, I'll share just a little bit. I'm definitely the most in-depth looking at the success and the dynamics of P1 was the study that you, Hunter, and Jean did. Looking at right now, we have a consistent caseload of around about 50, plus or minus a few youth on Project One docket. And with that, we also end up with a dozen or two, and it fluctuates, sibling cases. We feel like it's important for the families, and that's part of that Project One is one judge, one family. And so the whole, any sibling cases are also able to be heard. So with those, maybe about 75 kids, seeing Judge Robb on the P1 docket. We have about 84% involved with probation. And so that might be informal, formal probation, any range in there. And then right now, about 13% with parole. And just a couple of things that I think stand out, looking at, while there is a lot of resources going into Project One, a couple things, I think we're also using resources wisely, and it's helping benefit the court, the stakeholders, the families. A couple scenarios kind of before Project One and leading and now results is there was a mom who came to court one day, and she said that was her 4th court hearing that week with her kids. Different scenarios. With Human Services, she was ordered to obtain, or part of her case plan, to obtain and maintain employment. But 4 times that week, she had been required by the court to come to court. And so how is she supposed to maintain that job and be at court at the same time? And so one of the things Project One does is we combine those delinquency and those dependency cases. They're heard together, the siblings are heard together. And so that 4 times in 1 week is one time, as needed, at least twice a year for the semi-annual and annual reviews with the dependency cases, and, perhaps more with the delinquency needs as well. But we're not having those families need to come in. We're also not having to take 4 different hearing times off of the court calendar for those families. Another one that really stood out to me is we had a child receive 3 different psychiatric evaluations in a 6-month period. 3 different cases, ordered to have the psychiatric evaluations, and because the agencies weren't coordinating, he ended up with 3 different ones. So there's the financial cost, there's the time and the frustration of the kid, the family, the parents getting him there. And our stakeholders are really amazing at talking with each other, sharing information with these kids, so that there's not the expense, there's not the time, and there's not that frustration going into doing an evaluation after evaluation after evaluation because you have the different cases. So those were a couple examples that really stood out to me of some of the success or some of the positives that I see coming from Project One.
Thank you. I've got some questions for later, but I want to make sure that we move on to the 8th JDC and what they're doing as well with Cheryl. And to talk to us about the emerging initiative in Clark County, which began planning in April 2022. That's our understanding. And it focuses on the adverse outcomes that dual system youth sometimes present with depression and suicide risk, PTSD and substance abuse, teen pregnancy. So we heard some of that about in Project One examples, and risky sexual behavior, poor education outcomes. So those kind of dynamics prompted what the 8th JDC has put together, and that Cheryl's going to talk a little bit in some detail about.
Thank you, Hunter. I appreciate that. So in terms of that timeline of April 2022, we did a little exploration, I would say, prior to that, started having some important conversations, but I think that things started coming together in a more formalized way in April of 2022, when we contracted with RFK to sort of help us as we looked at developing a system or a program to best serve dually involved youth. So a lot of work happened, a lot of meetings with RFK, I would say between April 2022 and April 2023. And by April 2023, we had a policy or a standard operating procedure that was published at that point, so we could really look at roles, responsibilities, processes, and what was going to be most effective in helping dually involved youth. Really focusing on that multidisciplinary team approach. So we have our juvenile justice partners as well as our child welfare partners. And I can speak really specifically on the JJ side, what that looks like. So there are 4 probation officers, 2 which focus more on that intake or that initial identification and staffing. And then there are 2 probation officers that are dedicated to adjudicated, or so youth that are on formal probation that are duly involved. And then we have a supervisor who is very involved and really doing everything she can to support the officers through this process. So this multidisciplinary team, really important: child welfare, juvenile justice, and then some of the other important stakeholders that provide some of these services to our youth. One thing that came out of the early discussions too was the idea of having a multidisciplinary team summary report that's generated after the meeting, so that it can be given to the judicial officers and everyone involved in the case, so everyone's aware that that staffings have taken place, recommendations have been carefully reviewed, and the recommendations are being made are really what the team as a whole feels is in the best interest of that child. In terms of this stage of the initiative, I would say that we're definitely still in the learning phase. So this initiative for us is still in its infancy, and like any other document, I would say our standard operating procedure could be modified as we receive different information. If there are parts where kids are falling through the cracks and we need to strengthen certain areas or change certain processes, we're definitely open to that at this point. In terms of the criteria on the juvenile justice side for a youth being involved in the dual custody program would be any open delinquency referral. So I know in the beginning we had some different conversations about what that should look like in terms of criteria. I know at one point we were talking about adjudicated youth, and then I think the conversation from there went to, well, we'd be missing this whole segment of kids if our goal was really to try to prevent adjudication if possible, or prevent formal penetration in the system. So just at this point, it's that active referral. It doesn't need to be formally processed. Excuse me one moment. And I would say in terms of, and again, we're still in our infancy, but I did want to talk about some of the advances I think even that we've made in the short time that we've been working on this would be, I think we've received positive feedback from the judges regarding the MDT summary report. So the judges are finding them helpful. So getting that feedback is important. I know we also created what we call a bench card, and that's to help almost like a little cheat sheet for the judges to have on the bench, to where they can really help keep us accountable too. Have we gone through all the steps that we said we were going through? So sort of like some checks and balances, and also making them aware of our processes, our timelines, so we can all be on the same page and work as a team for the benefit of the child. And also the Nevada Rapid Indicator tool, that I don't think that's been discussed yet, but that's really a way of identifying youth that are being sexually exploited. And we're actually building that out in our case management system currently. So that's, I would say, in advance, and also working on a standard operating procedure to support the use of that NRIT tool. I think more generally, improved communication and care coordination. We've seen that definitely improve, streamlining of practices through the policies and through continued work together. And really, most importantly, the child feeling like they have a team that's behind them. And I think we've received feedback from some of the youth that we work with about that, helping children feel safe, that there are people looking out for them and working together in order for them to be successful, and really listening to what their needs are and what their goals are throughout this process too. In terms of challenges, I think anytime you make changes to larger systems or launch initiatives. There's always learning curves, continued education that needs to happen system-wide, whether that's the child welfare side or your JJ side. So even the staff that aren't working directly with these kids understand what those processes look like and that they've been informed. So if they have concerns about a youth on their caseload related to sexual exploitation, that they know that there's a process in place, they know there's someone they can reach out to get more information to figure out next best steps for a child. And I would also say that, you know, early identification is always a problem. You put a system in place, but sometimes there are kids can fall through the cracks. So what are those checks and balances that we have to make sure and ensure that we are identifying kids as early as possible and getting those resources in that will help stabilize and support those youth. And I notice I also have a couple teammates on this call. So if they'd like to add anything, I welcome them to do so at this time as well.
We'll give a moment for that, and they can interrupt me if they want. And but I'd like to go ahead and ask a few questions. We've got about 10 minutes, so if you got questions, you know, please put them in the chat, and we'll bring them to the right presenter. And let's take up the opportunity for doing that. I'm curious for the 8th JDC. In terms of identifying the youth for the program, how does that work? Is it automated, or is it manual, or kind of a combination of both?
I would say really right now it's looking to be a combination of both. So I think we started out with in our case management system having a checkbox that identifies dually involved youth with the staff and booking have the ability to access to Unity, which is our child welfare case management system. So they could quickly look to see at if those youth are also in the child welfare system and making those updates. There are some checks and balances with, I know, youth that come in overnight and reports being run on those. So I think that we're continuing to try to get better with that and automate as much as we can and not leave it to chance or reduce our manual options. And I think Horacio has a couple of things to add as well.
Yep. Please go ahead and unmute.
I don't know if he's having some issues and his mic isn't working. So I think he just added that we provided training to staff that might have first contact with youth and that we have youth and system outcome measures built in as well.
Okay, that's very interesting. If you can chat in maybe what a couple of measures are, just that would be, I think, probably really helpful to the audience. Yeah, if some come to mind in terms of what you maybe plan to measure.
And I might be able to add some of those as well. Reduced recidivism and new delinquency referrals, stabilization of volatile living situations, mental health stability, educational stability, and improve overall family functioning.
Excellent. Okay, then I would like to ask Lorilee. Lorilee is a case compliance specialist, which to me is a really neat position that a lot of jurisdictions lack in terms of bringing all this together. So if Lorilee could talk a little bit about what it's like to be a case compliance specialist for dual system youth, for Project One youth, and then a little bit maybe about how you identify the nuts and bolts of being able to see clients for the special docket.
Okay, sure. I feel like I am still in my infancy in this position. I've been here about 9 months now, so about 8.5, so longer than what it feels like maybe. There's been a lot to learn. But what I try to do is make sure I'm aware of all of the youth who we have on our docket, where they're at in their cases, any needs that they have when they have their next court hearing. I write up and summarize the information in their case to give to Judge Robb, so she has kind of a snapshot view going into court hearings and kind of look and see what does she need to dive deeper in and just see that overview. I work with stakeholders in scheduling hearings, setting stakeholder meetings. We're kind of getting that back ramped up because there was a break with that. And really, we have a lot of different people involved with this. And so we have our outside agencies that are the stakeholders within the court. We also have a lot of people who are very aware of Project One and the youth that qualify for it. And so we have youth identified by our delinquency court, by our dependency court. I'll receive emails saying, hey, you know, this one, keep on your radar. Just opened a dependency case. Here's the status of it. And so I'll kind of get the play-by-play as that's happening. And then once the dependency case is adjudicated and the youth is in human service agencies care, then as long as they have the delinquency case, they qualify to come to Project One. And so at that time, we'll move them. I'll work with both the delinquency judge, Judge Robb, and the dependency judge, getting orders signed, transferring that case to Judge Robb with Project One or Department 13. On the dependency side too, I receive most days a list of all new youth who are in detention. And so I look at each kid that's on the detention roster and see where their status is. Do they have a dependency case? And kind of follow along that way. So that's some of the different things that I do. And I may have missed part of your question in there, but I'm happy to answer any more there.
No, that was wonderful. I appreciate you letting me put you on the spot like that.
Hunter, there is one more. We try and gather as many people as we can so that we minimize the number of hearings that parents have to come to. And so we have on occasion when there is a divorce or custody case pending, that becomes part of P1 as well, so that we have that all together in one place and we can do all of the hearings at the same time. So even though the stakeholder involvement isn't the same, the parents are at the hearing, they're informed by what's going on, and then we can deal with that custody and divorce matter involving that child as well, so that we don't have, once again, the parents having to come to court multiple times in a week to try and deal with different, different court aspects of their whole family dynamic.
That's very interesting. So we got Paula Smith has asked, how often do they go to court or return to court? So how frequent is then we'll start with maybe with Project One, with Lorilee and Judge Robb.
We are guided by a couple of different deadlines. So in dependency, we are following those federal guidelines for when we need to have those hearings. But in the delinquency case, many times especially the JPO wants to have just a hearing maybe 30 days out so that we can see how this particular youth is doing. And sometimes when they understand that there is going to be more supervision, that is helpful to their outcome. And so we are pretty flexible. We'll have those hearings as often as we need to for the particular youth involved. The other thing that we try and do, it's best to have the parents in the room, but they work and jobs are important. And so we will accommodate parents by using Zoom if we need to. We accommodate if we have to by using telephone appearances. It's important that they be there, that they understand what's going on. I like them in person best. But if they have to be at Tesla or one of the gigafactories outside of Reno, and to get to a hearing means they're going to be on the road for at least 45 minutes each way, they've lost a day of work. So we also try and work around those things and be sensitive to that.
And Cheryl, how does that, is it going to work, or is it working with the 8th?
I would say similar to what Judge Robb outlined on the juvenile justice side. I think there's a lot of flexibility and needs to be a lot of flexibility in there. You want enough time to see if the interventions and services are working, but also the flexibility if there is a big hiccup that everyone needs to come together and know about. We like the ability to be able to put something back on calendar if needed.
Okay, and we have a 1 minute left. So I think what I'll just share is the last few slides here, where we provide resources in terms of going to the crossover youth practice model, which has stimulated so much of the innovation across the country. And also the RFK National Resource Center for Juvenile Justice, which helps to generate the 8th JDC's model and the resources that they have. And then there's, we weren't sure we were going to be able to get representatives from both courts here. So you have at the end of the slide, emails to get a hold of myself, Gene Siegel, or the NCJJI director, Kristan Russell. But if you don't mind, maybe Cheryl and Lorilee, maybe putting in your emails into the chat for folks that might want to directly ask you for some of the tools you described, because you had some really interesting tools, like the judicial bench card or checklist in the 8th JDC was really intriguing to me. So if you could put those in the chat, and folks could get ways for them to get a hold of you. And we'll conclude. We'll follow up with the slide deck to everybody who registered. And we really appreciate you joining us for this webinar, and for our friends from the 2nd and the 8th JDC joining us to share about their innovations.